Welcome to the Vet Dental Show. I'm Brett Beckman, board certified veterinary dentist, and we bring this podcast to you every Wednesday as a veterinarian, as a technician, as a dentistry team to help you be even better at veterinary dentistry in your practice. We're sponsored and partnered today with the Veterinary Dental Practitioner Program. If you're interested in being among the best anywhere in general practice as a team in veterinary dentistry, I invite you to request an invitation. Just go to ivdi.org/INV, like invitation, first three letters INV. So IVDI, International Veterinary Dentistry Institute, ivdi.org/INV, and we'll get you the information that you need. All right, Julie had a question. This is a great question. Any recommendations for labs for histopath? Dr. Cindy Bell is our pathologist of choice. She does only oral pathology for dogs and cats. She used to be at the University of Wisconsin. Then she went to Kansas State, and now she has her own lab. She had extensive experience at Wisconsin and developed a love for oral pathology. And consequently, now she's got her own lab. She's opened this up a couple years ago. And the URL, put Cindy Bell and SOPA, and it'll come up. But I think it's sopforanimals.com. But that is where I would suggest that all you guys that have cases where you would not have something routine, especially that looks a little unusual, that you would send your histopath to Dr. Bell. And Dr. Bell is going to require that you also send radiographs and also send gross images to help her really fine-tune some of these tougher cases. She's amazing. There's nobody like her in the world. She's the most experienced and the most thorough. If you have a case or if you want to use her for everything oral, certainly that's the way to go. A lot of our Academy members use her exclusively only for that purpose. Christina, do we sell this product in our clinic, or is the company willing to sell to wholesale? Healthy Mouth, we personally do. Currently only keeping, I think, Annie, you can correct me if I'm wrong, I think we're only keeping the 8-ounce with us, and the option to order from the client's standpoint online is there as well. So they will, I'm pretty sure you have to call the company, set up an account with them, and they will deliver at distributor prices to you where you can sell from the clinic, or if you don't want to fool with that, you can just have that and let the client get it. I think the problem with letting the client get it the first time is that probably they're going to forget. But if you dispense the small 8-ounce bottle or whatever it is first and let the client use it, then you get them used to using it, they're more likely to reorder, or they're more likely to get it from you again. I think that's a good way to do it. If I had to put a catheter in now, I probably could not. I did the same thing when I was in emergency and critical care for 13 years. We didn't always have an extra tech there. I did put a lot of catheters in by myself. I always intubated, or not always, but most of the time intubated by myself. And lo and behold, when I ran into Annie, she's really the only one that has ever done that. And now Jen's doing it as well. So it's really great to have that. It's a good skill to have and a good one to learn. And and why I'm on that subject, I think this is important. There's a lot of things that we've always done. This is one of them. We've always assumed that we need somebody to hold the patient, and we need somebody to hold the arm off. You don't have to do that. Certainly, if there's any question about whether you're going to get bitten, or in a case of a cat scratched or otherwise bitten, then you definitely want a muzzle. There are going to be some cases where you don't or you won't be able to do that. But if you are a practice owner and you have techs that are pretty good at putting catheters in, guess what? They can probably put a catheter in by themselves without the help of another tech or you. It's just a matter of paradigm shifting. Same thing with our anesthesia protocols that we use. We just keep the patients really light. And so we don't have problems under anesthesia. They wake up immediately. Most practices don't do that. So it's part of thinking, hey, how can we do this different? Those are two examples where we've always done it that way, so that's the way to do it, which is not correct. It doesn't have to be done that way. Sorry, sometimes I just talk about things that I feel like talking about. I don't talk about things that I should be talking about, but I think you get the picture. Looking at this question, when we're differentiating any oral inflammation in a cat, where stomatitis is a potential rule out just because the tissue looks angry adjacent to the teeth, if you biopsy that tissue, if it's significantly inflamed and it's been there for weeks to months, that biopsy is going to very likely read out as stomatitis. The respect that it is stomatitis definitely does not mean that is feline gingivostomatitis. The differentiating factor between any oral inflammation adjacent to the teeth and feline gingivostomatitis is caudal oral mucosal inflammation. That being said, the reason why that is read out as stomatitis is it's very similar, if not identical, just because of the influx of plasma cells into that tissue because it's chronic. You take it from the caudal mucosa or the gingiva, it's going to probably read out exactly the same, even though it could be periodontal disease. So there's really no reason, unless you suspect squamous cell carcinoma, to biopsy a stomatitis case. If you've got a case where you've got a gingivostomatitis case where you've looked at the cat with the mouth open, and not only are the teeth affected, but the caudal oral mucosa, as you're looking back beyond the palatoglossal folds, is also reddened and infected and most of the time proliferative. So that is the differentiating factor. It's not histopath. The only, again, reason that I would biopsy a case is if I had a unilateral, more proliferative area in a bilateral case, or if I had a unilateral inflammation back there, I wouldn't be thinking stomatitis. I would be going straight to thinking squamous cell carcinoma. Could be some other mass. It could be something else. But that would 99% probably, if it's a unilateral mass, it's probably going to be squamous cell carcinoma. I hope that straightens that out for everybody. That's a very important distinction. We get a lot of patients that come in where the referring veterinarian has looked at the patient, and the patient may be anywhere from 7 months to 10 years of age, and they're referred for stomatitis when actually they may have had a biopsy before, but the patient doesn't have gingivostomatitis. They have just stomatitis in the attached gingiva adjacent to the tooth because it's severe gingivitis. I hope that clears everything up. If there's no boarded dentist, you could certainly refer to a surgeon for oral masses. Unfortunately, as a group, we have had some pretty bad nightmares in having to go in and repair things that surgeons have done in the past, either ectomies or more commonly fracture repair. Always, if you have a choice, refer to a board certified dentist. They have had actual practical exams where they have had to do those procedures and had to pass those procedures with other dentists grading them. And it has to be virtually perfect in order for a dentist to become a board certified dentist. Surgeons don't have any practical exams. So you can bet that the veterinary dentist is going to be well trained to do anything like that over a surgeon. So there may be surgeons that are better than some board certified veterinary dentists that have had training specifically or experience. But in general, the best bet is a board certified dentist. I hope you enjoyed this episode. There's a lot of actionable items in there that you can take and use in your practice immediately. So put those to work and enjoy the benefits for the practice lifetime in your dentistry service. If you'd like more information about the Veterinary Dental Practitioners Program, please submit to request an invitation at ivdi.org/INV.